Hi, my name's Tim. This is going to be my head to toe assessment video. We'll do an environment scan. Enter my patient's room, perform hand hygiene, provide patient C 360 degrees. Introduce myself to my patient. Hi, my name's Tim. I'll be doing my head to toe assessment on you today. If at any point in time you have any questions or concerns, please let me know. And could you tell me your name and your date of birth?
Joseph, September 1st, 1982.
Great. And I'll check that with their armband. And I'll check that with the MAR and make sure we have the right patient. Gonna get started. I'll do some vitals. Temperature should be 96.7 to 100.5. Pulse should be 60 to 100 per minute. Rate, rhythm should be regular. Amplitude should be 2+. And anytime in this assessment video today when I'm checking pulses, I'm checking for that, as well as bilateral symmetry. Respirations should be 12 to 20 per minute. Rhythm regular. Depth shouldn't be overly shallow or overly deep, appropriate for the situation. Oxygen saturation should be 95 to 100%, and blood pressure systolic should be 90 to 140 over diastolic 60 to 90. Next, I'm going to assess my patient's pain. Are you in any pain today?
Nope.
If my patient was in pain, I would rate it on a 0 to 10 scale, 0 being no pain, 10 being the most pain you've ever felt. I'd also assess it using something like the Colder method. I would ask about character, onset, location, duration, exacerbation, does anything make it worse? Relief, does anything make it better? And radiation, does the pain radiate anywhere? So you're not in any pain, so we're going to move on. I'm going to assess my patient's level of consciousness. I know that he's awake and alert. He's able to tell me who he is, so I know he's oriented to himself. So I also want to ask about time, location, and situation. So I'd ask him, do you know what day and year it is?
It is Tuesday, 2021.
Great job.
Yes.
Do you know where we are right now?
We are in my home.
Awesome. And do you know what we're doing today?
We are doing a head-to-toe assessment.
Awesome. So he's answered all those, so I know he's oriented to himself, the time, the location, and the situation. Also, his mood is cooperative. He's answering my questions, and his behavior and affect are appropriate for the situation. So next, I would inspect and palpate for my patient's skin, which I would be doing throughout the whole assessment for temperature, color, moisture, lesions, edema. I would also be inspecting and assessing and palpating for any invasive lines, IV lines, drains, tubes, or wounds. I would also rate my patient using the Braden scale, max score of 23, and anything 18 or below I know puts my patient at risk for developing a pressure ulcer. So we've done vitals, we've done pain, and we've done skin, so we can move on to, and we've done level of consciousness, so we can move on to the actual physical assessment. So first I would start with my patient's head and scalp. I would look for normal shape and size and distribution of features, which they are. I would assess my patient's vision. Do you wear any glasses or contact lenses? Do you have any trouble seeing? I would move on to my patient's hearing. Do you have any trouble hearing? Can you understand me right now?
Yes.
Yeah.
No trouble hearing.
No trouble hearing. Do you wear any hearing aids?
No.
Okay, great. So next, we're going to inspect the patency of the nares. So I would include one nostril at a time. Ask my patient to breathe in and out. Breathe in and out. So you can breathe in and out. So patency of both nares. Next, we're going to move down, assess the 9th and 10th cranial nerves, 9th glossopharyngeal and the 10th the vagus. So I would ask my patient to open your mouth. I would inspect lips, teeth, gums, tongue, and oral mucosa. I would ask my patient to stick your tongue out, say ah. I'm looking for the palate to rise symmetrically, which it does. That's great. And we're just going to verbalize it today, but to assess the 10th cranial nerve, the vagus, I would use a wooden tongue dispressor depressor and assess my patient's gag reflex. So next we're going to move on to the eyes. I'm going to inspect the eyelids and the eyelashes for equal distribution and symmetry, which they are. So now I'm going to assess third, fourth, and sixth cranial nerves, third oculomotor, fourth trochlear, and sixth abducens. We're going to use the star pattern. I'm going to ask my patient, keep your head still and just look straight ahead.
I'm going to sneeze in a second.
Okay.
I think we're good. Go ahead.
You good? All right. So I ask my patient to just look straight ahead, keep your head still, and follow my finger with your eyes. And I'm going to use a star pattern, and I'm just going to watch and see that my patient is able to track my finger through all the points of the star with their eyes, which they can, that's great. So we're going to move on. We're going to assess pupil response, third cranial nerve, ocular motor. We're going to use PERLA. Pupils equal, round, reactive to light, and accommodating. So I'm going to ask my patient to just look straight ahead at this finger, and I'm going to shine a light in left eye. I'm going to look for both pupils to constrict equally. Again, in the other eye, looking for both pupils to constrict equally, which they do. Now focus on my finger. I'm going to bring it to my patient's nose. I'm going to look for their eyes to cross equally, which they do, so that's great. So now we can move down to assess the 11th cranial nerve, spinal accessory. So I'm going to put my hand on your shoulders and just shrug up against my shoulders. That's great, you can. All right, now I'm going to put my hand on your cheek and just push against the resistance. That's great, other side, awesome. All right, so now we're going to move on to the neck. If my patient wasn't already sitting up, I would assist them to a 45-degree angle. We're going to first look for jugular vein distension. I'm going to look for any veins that are bulging or distended, which would be an abnormal finding, possible fluid overload or heart failure, but I don't see any, so that's good. That's a normal sign. So now we're going to inspect and palpate the carotid arteries one at a time for rate, rhythm, and amplitude. So there and there. It's great. Again, 60 to 100 per minute, rhythm regular, amplitude 2+. Now we're going to auscultate for the carotid arteries, one at a time using the bellow of the stethoscope. I'm going to listen where I palpated. And what I'm listening for is, I would hear, normal would be, I would hear nothing, maybe S1 or S2 heart sounds. Abnormal findings would be bruits or a swooshing sound, which could mean that the patient has narrowed arteries or turbulent blood flow. So now we're done with the neck. We're going to move down to the upper extremities. So could I see your hands? I'm going to inspect capillary refill on all 10 fingers, looking for 3 seconds or less in each finger. I'm going to palpate at the same time for radial pulses, again 60 to 100 per minute, regular rhythm, bilateral symmetry, amplitude 2+, that's great. So now we're going to do some range of motion. Can you shrug your shoulders like this? You bend your elbows, flex your wrists, great. Now squeeze my hands for strength, just my fingers.
Oh, okay.
Yeah, like that, that's great. Good strength. So now we're going to assess sensation. So I'm going to have you close your eyes, and then I'm going to touch you on your arms, and you tell me where I'm touching you on your arms. Okay? Close your eyes. Where am I touching you?
Yep.
Where?
Oh, both arms.
Yep. Where? Lower or upper part of the arm?
Middle.
Great. Now where am I touching you?
Lower shoulders, both.
Great. All right, you can open your eyes again. So we're done with the upper extremities. So we're going to move on to the chest. I'm going to look for AP diameter. We want it to be twice as wide as it is deep, which it is, so that's great. So now we're going to move on to respirations and lung sounds. I would assess my patient's respirations, which again should be 12 to 20 per minute. Rhythm regular, not overly deep or overly shallow. So now I'm going to auscultate for lung sounds. We're going to make sure we listen to all 5 lung lobes using you can use, what I'm going to use is 8 spots on the front, 6 lateral, and 10 on the back. And normal findings, I would hear just regular breath sounds or mixed breath sounds. Abnormal findings would be wheezing, rhonchi, crackles, stridor, or pleural friction rub. So now we're gonna auscultate using the diaphragm. You just breathe in and out normally. 1, 2, 4, 5, 6, 7, 8. All right. Lift up your arm. 1, 2. Lift up your arm. 1, lift up your arm. All right. Now, if you could turn this way so your back is towards the camera, maybe the other way.
Can?
Maybe your feet this way. Yeah, that's great. Just breathe in and out. Same thing. We're gonna do 10 spots on the back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Using the H or the ladder pattern. So now we're done with lung sounds. We're going to move on to the heart. I'm going to inspect and palpate for the point of maximal impulse, which is the 5th intercostal space, left sternal border, mid-clavicular line, just be about here. So I would inspect and palpate for rate, rhythm, and amplitude, again, 60 to 100 per minute. Rhythm regular and amplitude 2+. So that's great. So now we're going to auscultate for heart sounds. We have 5 spots that we want to listen to. So we'll listen to those. And so we're going to start at the 2nd intercostal space, right sternal border, aortic valve. S2 should be louder than S1. 2nd intercostal space, left sternal border, pulmonic valve. S2 should be louder than S1. 3rd intercostal space, Erb's point. S1 and S2 should be equal. 4th intercostal space, left sternal border, tricuspid valve. S1 should be louder than S2. And 5th intercostal space, mid-clavicular line, is the mitral valve, and S1 should be louder than S2. So now we're done with the heart. We're going to move on to the bowel. When was your last bowel movement?
This morning.
Great. And have you been having any trouble with diarrhea or constipation?
No.
Any trouble with urinary incontinence or retention?
No.
Okay, great. So now we're going to inspect the abdomen. The contour should be flat or slightly rounded. Abnormal would be any gross distension or bulging or maybe some visible hernias. We don't see any of that. So now we're going to auscultate for bowel sounds. I'm going to listen for a minute in all 4 quadrants, and I want to hear 5 to 30 bowel sounds per minute. And then if I don't hear anything, I want to listen to each quadrant again for at least 2 minutes, or up to 5 minutes would be ideal. So we would auscultate. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant for those bowel sounds. And then I would palpate the same 4 quadrants for any pain, tenderness, or masses following the same pattern. Right lower, right upper, left lower. Do you have any pain or tenderness? I didn't feel any masses, so that's great. So now we're going to move on to the femoral artery, which I will demonstrate on myself. We're going to palpate for the pulse, be about there. So that's great for rate, rhythm, and amplitude. And now we're going to move on to the lower extremities. Could you put your foot down? So I'm going to inspect capillary refill in all 10 toes. Should be less than 3 seconds. I would palpate the pedal pulses on top of the foot for rate, rhythm, amplitude, and bilateral symmetry, and the posterior tibialis pulse behind the ankle for the same rate, rhythm, amplitude, and symmetry, which they are, which that's great. So now I'm going to have you stand up. We're going to do some range of motion. So starting with your right leg, can you lift your foot up like that and rotate your ankle, lift it up behind you and out to the side. Great. So your knees, your hips, and your ankles are working. So left side, same thing, ankle, behind you, out to the side. Awesome. All right, sit back down. We're gonna assess for strength. So can you just push up against my hands? That's great. Now kind of kick your feet out against my hands. Now pull down against my hands. Great. All right, we're gonna assess for sensation. Close your eyes and tell me where on your legs I'm touching you.
On the sides, in the middle.
All right, and now?
On the sides, on the top.
All right, great. So that concludes my head to toe assessment. Thank you.